Hi everyone, my name is Tatiana and today I'll be presenting on depression as a major mental health issue in the Australian context. I'll start by describing what depression actually is and what it looks like in people's everyday lives. I'll then explore how it affects Australians specifically, including who it impacts the most and why. After that, I'll discuss the main risk factors that contribute to depression and then move into treatment options, looking at both the benefits and challenges of different approaches. I'll also highlight how trauma interacts with depression, because trauma is one of the most important but often overlooked aspects of mental health. Finally, I'll summarize the key findings and share how studying this subject has influenced the way I now think about depression. So let's begin. What is depression? Depression is one of the most common mental health conditions worldwide. It's more than just sadness or having a bad week. The DSM-5 defines it as a period of at least 2 weeks of persistent low mood or loss of interest, accompanied by other symptoms such as low energy, changes in appetite or sleep, difficulty concentrating, feelings of guilt or worthlessness, and in some cases, thoughts of suicide. What's important to understand is that depression doesn't only affect emotions, it impacts the whole body. People may experience physical pain, digestive problems, and low immunity. It also disrupts daily life, from studying and working to relationships and social connection. Depression is now one of the leading causes of disability worldwide because it doesn't just lower quality of life, it also reduces productivity, increases healthcare use, and is linked with higher rates of suicide. That's why it's such a significant public health issue. Depression in the Australian context. Now, looking specifically at Australia, depression is very common here. The Australian Institute of Health and Welfare reports that about 1 in 7 Australians will experience depression at some point in their life, and at any given time, around 3 million Australians are living with anxiety or depression. It's also one of the top contributors to disability in Australia. The burden is not evenly spread across the population. Women are more likely than men to experience depression, and young people aged 16 to 24 are particularly vulnerable. Depression also has significant cultural and social dimensions. For Aboriginal and Torres Strait Islander peoples, the rate of depression is about twice as high as the non-Indigenous population. This is linked with ongoing impacts of colonization, intergenerational trauma, racism, and lack of access to culturally safe healthcare. People in rural and remote communities are also at greater risk, not only because of social isolation and limited resources, but also due to stresses like drought, bushfires, and floods. These environmental challenges affect mental health directly and can make recovery harder when mental health services are located hundreds of kilometres away. So when we talk about depression in Australia, we need to think not just about individual experiences, but also about the broader cultural, social, and environmental factors. Risk factors for depression. There's no single cause of depression. It usually develops from a combination of factors. Biological risks include a family of history of depression or changes in brain chemistry. Chronic illnesses like diabetes, cardiovascular disease, or chronic pain can also increase the risk. Psychological factors play a huge role. For example, people with low self-esteem, perfectionist traits, or negative thinking patterns are more vulnerable. Prior mental health issues like anxiety can also increase the risk. Social and environmental risks are equally important. Financial hardship, unemployment, relationship breakdowns, or social isolation all contribute. When we place this in the Australian context, there are unique factors at play. We know that large-scale natural disasters like the Black Summer bushfires had long-term mental health effects. Research found increased rates of depression and post-traumatic stress disorder in fire-affected communities. Similarly, the COVID-19 pandemic created widespread uncertainty, loss of work, and isolation, which particularly impacted young Australians. So when we look at depression, it's really an illness shaped by the interaction of biology, psychology, and society, not just one factor alone. Treatments for depression. The good news is that depression is treatable and recovery is absolutely possible. Pharmacological treatment usually involves antidepressant medication, most commonly SSRIs. These medications can help rebalance brain chemistry and reduce symptoms. The positives are that they work well for many people and can stabilize mood, but there are challenges. They can take weeks to become effective. They can cause side effects like nausea, weight gain, or sexual problems, and for some people, they may not work at all. Psychological therapies are another important option. Cognitive behavioral therapy, or CBT, is one of the most widely used and evidence based. It helps people identify and change unhelpful thoughts and behaviors. Acceptance and commitment therapy, or ACT, focuses on values based living, and mindfulness therapies help people manage stress. These therapies can be life changing, but they require time, effort, and access to trained professionals. In rural and remote areas, access to therapy can be very limited, which is a big disadvantage. Community supports like Beyond Blue, Lifeline, and Headspace provide free and accessible help. These services are particularly valuable for people who may not feel ready to see a doctor or a psychologist. Finally, holistic and lifestyle-based approaches like exercise, healthy eating, sleep hygiene, and social connection are now recognized as powerful tools for improving depression. Even 30 minutes of daily physical activity has been shown to reduce symptoms. So overall, treatment for depression is effective, but there are barriers: stigma, cost, waiting times, and unequal access across different communities. That's something we really need to keep addressing in Australia. Trauma and depression. One of the most powerful risk factors for depression is trauma. Trauma can take many forms: childhood neglect or abuse, sexual violence, domestic and family violence, or systematic trauma such as colonization. When someone experiences trauma, it changes the way the brain and body respond to stress. This makes people more vulnerable to depression later in life, and it also makes treatment more complicated. People with trauma histories often experience more severe symptoms, longer episodes, and a higher chance of relapse. In Australia, trauma is particularly relevant for Aboriginal and Torres Strait Islander peoples who live with the ongoing impacts of colonization, forced removals, and cultural disconnection. This is known as intergenerational trauma, and it contributes significantly to the higher rates of depression seen in the Indigenous communities. That's why trauma-informed care is so important. Trauma-informed care means creating a safe and supportive environment, building trust, giving people choice and empowerment, and always considering how trauma might shape their behavior and symptoms. It shifts the question from "what's wrong with you" to "what happened to you?" and that makes a huge difference. To sum up, depression is one of the most common and disabling mental health issues in Australia. It develops through a mix of biological, psychological, and social factors. Treatments are effective, but barriers like stigma, cost, and rural access remain major challenges. Trauma plays a central role, both as a cause and a complicating factor, which makes trauma-informed care essential. Personally, studying this topic has changed the way I think about depression. Before, I thought of it mainly as just a mood disorder, being sad for a long time. But now, I understand it's a much more complex condition, deeply connected to trauma, social disadvantage, and cultural context. As a second-year nursing student, this has made me realize the importance of approaching patients with empathy, seeing the bigger picture of their lives, and working towards trauma-informed, culturally safe care. Thank you for listening.